Hey, this is Dr. Tom Rogers at Performance Medicine, coming to you today from my guitar room, my music room in my basement. And I'm going to talk about something. Since it's mid-May, it's been a really rainy, cold spring so far, but I think that's gone and we're going to have a lot of sunshine, a lot of warmth and all. And so we got to start thinking about the sun. And today I'm going to be talking about the pros and cons of getting sun. Each morning, Apollo's fiery chariot races across the sky, giving life-giving light to our planet. So what I'm going to talk to you about today is how there's a lot of misconceptions about getting sun, getting a tan. We'll talk about getting sunburned and the pros and cons of getting out and getting some sun. As you can probably suspect, the pros are going to far outweigh the cons of getting out in the sun. We've been somewhat misled by this and scared to death to get out in the sun and get sunlight. And we've been slathering chemically laden sunscreen all over our bodies, which probably has a worse effect than getting a tan for sure. We don't want you to get burned, but we do want you to get sun every day that you can. So we're going to talk about that a little bit. As you know, Apollo was the god of healing and medicine as well. That's why I mentioned that little thing that I'd read years ago about sunshine. But anyway, there's two types of UVA ray or UV rays, type A and type B. Type A is 95% of the rays. Type B is 5%. And think of type B as causing the most burns, sun burns. And it definitely can cause skin cancer, but directly because of its actions directly on the skin. But also UVA rays can cause skin cancer and certainly aging of the skin more indirectly by changing your DNA and the molecules that it produces. Think of oxygen-free radicals and the damage they and UVB rays do to the collagen in your skin. And so there's no doubt that, too much sun and especially UVB rays, if you get a sunburn, can cause premature aging, wrinkling, and even skin cancers. So they both do damage your collagen by different methods. So also can cause cataracts and maybe activation of certain immunosuppressive diseases, and possibly even some reactivation of latent viruses in your system. But there's three types of skin cancer, basically: basal, squamous, and melanoma. And we'll talk about those a little bit. I myself have had one basal and two squamous cells taken off my skin by my brother, and fortunately no melanomas yet. But as we age, there's no doubt that our skin is more susceptible to at least the basal and the squamous cell and not melanoma. Melanomas are a different breed. I talk about melanoma sometimes because they can kill you. They can metastasize and definitely kill you. So we tout staying out of the sun because you definitely don't want to get a melanoma, but a lot of melanomas, it turns out, that I've found and that are found worldwide are really found in non-sun exposed areas. So how do you explain that? If you do the research, melanomas are more of a genetically determined thing based on how many nevi. Nevi is a word for a mole. It's a flat mole or dark place on your skin, akin to a freckle but darker usually. And it turns out that melanomas are about 30 times more related to the amount of nevi you have on your body than the amount of sun exposure that it can cause. But there's no doubt sun can cause melanomas, but there's more frequently causes by about 30 times, and that's these familial type of nevi that you have on your skin. That's why you should screen your skin for the amount of moles and how they appear. You know, when you have a lot of what's called dysplastic nevi on your skin, you're a lot more at risk for developing melanomas than you are by getting sun. So I want you to remember that point. As far as the most common type of cancer in the world, it's probably skin cancer. And the most common form of skin cancer is a basal cell, which doesn't metastasize, or very rarely. Now, it can erode locally. Squamous cell is more likely to spread, and it can rarely metastasize too, so that's not a good one. But you know, most of us, if we've been in the sun long enough and lived long enough, we're going to have a few skin cancers, and they're pretty easily treatable. You know, we treat them every day in our office. But anyway, so a lot of this has to do, the benefits of the sun, most of it has to do with something that I harp on every day for people, and that's because it increases your vitamin D levels. The sun, when it hits your skin, it's transformed into the active form of vitamin D, which has so many benefits. I don't have time to sit here and talk about them, but you know, especially during COVID season, we've talked about how important vitamin D levels are. So please get your vitamin D blood levels checked. And every human should be taking vitamin D. So turns out the main function of vitamin D is to maintain your calcium and phosphorus levels to support most metabolic functions, neuromuscular transmission, and of course, bone mineralization. Vitamin D is a hormone. We've always talked about it being a hormone, and it's one of your most potent hormones in your body. You know, at Performance Medicine, over half of what I do is concerned with hormones, and that's maybe the most important hormone in your body is vitamin D. You think of low levels of vitamin D causing rickets in kids back in the, you know, early 1900s, and it was, of course, caused by low vitamin D. When I discovered that, rickets virtually disappeared. But also think about adult osteoporosis, osteopenia, and that's caused by low vitamin D also. That's much more common these days. And remember, when I say as an adult, you should take your D with K. Remember, vitamin K helps the D bring the calcium into your bones, not your arteries. You do not want calcified arteries and joints too. But anyway, so what about vitamin D? There's a lot of difference in the way people absorb vitamin D. Certainly, darker skinned people have lower vitamin D levels. And that's an evolutionary thing. Think about living up north when you don't get the sun. We have a lot more incidence of all kinds of diseases. Those people, lighter skin or pale people, they need more vitamin D. So this adaptive response enables them to get vitamin D a lot quicker through sunlight than darker skinned people. If you're darker skin, Latino, Black, etc., you definitely need more vitamin D supplementation than a pale person would. So it's an evolutionary thing. Also, we find that obese people don't absorb vitamin D very well. And certainly elderly people with their thin skin can't manufacture enough vitamin D. And that's when they're getting osteoporosis. So think about that. But think about, everybody harps on, you know, the sun causing skin cancers, but think about the cancers that the sun prevents because it increases your vitamin D levels. Cancers like breast, ovarian, colon, pancreatic, prostate, lymphoma. They're much more frequent in higher latitudes where the vitamin D levels are a lot less because you don't get as much sun. And other non-cancerous diseases like MS, rheumatoid arthritis, even high blood pressure, metabolic syndrome, even type 1 diabetes. Several studies have shown that in kids, which mostly type 1s developed, the people that have enough vitamin D have a lot less of it. As a matter of fact, 80% less type 1 diabetics in kids that receive at least 2,000 units of vitamin D starting from age 1. I wish I'd have known that back when my kids were growing up as kids, because I have 2 type 1 diabetic kids. So vitamin D is very important in preventing type 1 diabetes, which is a lifelong illness. As I can tell you, it's not a fun disease to have. It's a constant thing if you have type 1 with your insulin, counting carbs, pricking your finger, etc. So it's hard to be a type 1 diabetic. So kids with a low vitamin D level are at 4 times the risk of developing type 1 diabetes, but also type 2 diabetes. Think about that. And metabolic syndrome. They are all increased with low levels of vitamin D. We've already talked about COVID, how 9 out of 10 patients in the hospital with COVID had low vitamin D levels. So it should be shouted from the rooftops, take vitamin D. It's been known for decades that vitamin D protects against viruses and bacteria. That's why, tuberculosis, get out in the sun and it gets better. They've known that for decades. It's just incredible the benefits that the sun will give you. Look at the viruses like influenza. Do you know why it's more common in the winter? Because you don't get enough vitamin D in the winter. So think about that. It's really, one professor, I think it was one of the California medical schools, said that the single most important action to reduce cancer in North America and Europe, besides not smoking, is getting vitamin D. Now, that's an incredible statement. So you need to get sunshine, which brings me to talk about even your mood, even your pain levels. The sun helps your mood not because you're at the beach and having fun, which can be a case, but it's because of the hormone melatonin. If you get a lot of sun, it makes your melatonin work better at night. You sleep better. And remember, serotonin is the melatonin precursor. Melatonin comes from serotonin, the feel-good neurotransmitter. Most of these antidepressants increase your serotonin, so think about that. The sun by UV rays also increase your endorphins, and your endorphins are just your natural opiates, so it's going to help pain as well. So let's talk about sunscreens. Should you slather sunscreen all over your body, put it on your babies and your kids? Well, maybe, if it's a good sunscreen. But it's real important the type of sunscreen you use. And certainly don't use the spray form, the aerosolized form of sunscreens. Those are terrible. They can get in your lungs. They don't cover you well enough. It's just a marketing ploy. Please do not buy the sunscreen sprays. Avoid fragrances and parabens, PABA. Avoid the worst one is Oxybenzone. If you look in there on your sunscreen and it has Oxybenzone, if you put it on your kids, you're nuts. It's a well-known endocrine disruptor. Think about hormonal disruption. You better avoid that and a lot of other these crazy chemicals they put in sunscreens. Most sunscreens, if you use it, should have some form of zinc in it. although it can turn your skin kind of whitish. It looks kind of crazy, but it's natural, doesn't hurt you. And zinc oxide. And there's another one called titanium dioxide that's in most mineral-based safe sunscreens. The titanium dioxide is a little controversial, but they put it in food. It is approved by the FDA. Whether or not that means a lot or not, it probably does somewhat, but other controversies about that I won't get into today. But some of them just have zinc oxide in them. But titanium dioxide is a natural mineral, but you certainly don't want to inhale it. That's one reason you shouldn't use an aerosolized form of a sunscreen with that in it. But I like the sunscreens that have other things in them too, like aloe and some moisturizers. There's a couple that we have in our office. One's Glytone, the other one's SkinCeuticals that are very, very good. Just talk to Kelly about the sunscreens, the safe ones to use. So, if you're out in the sun for prolonged periods of time, you probably do need a little bit of sunscreen to avoid a burn, avoid the free radical damage that prolonged sunshine can give you. And you need to reapply it every couple hours. Remember also to drink a lot of water. And I think these sunscreens work best when paired with vitamin C serum. So I'm not against all sunscreens, believe me. You don't want to get sunburn because it definitely can cause skin cancer and can age your skin prematurely. So don't be afraid to get out in the sun. Don't overdo the sunscreen. Certainly use the natural sunscreens. Read what's in it. Avoid using the sprays. Don't be afraid to get out in the sun and get a little sun on your skin, especially during the high noon hours. You don't need the prolonged skin exposure, but get about 40% of your body exposed to some sunshine if you can every day, between the hours of 10 and 2. But don't burn your skin. If you're in the sun for too long, protect your skin with something safe. And I hope this helps you as we head into the summer season, going to the beach and all. It's Dr. Tom Rogers at Performance Medicine. I'll talk to you next week.